Hi, so first off I'd like to wish all my subscribers and viewers a Merry Christmas, and that being out of the way, I'd like to talk about how medications affect refractive error in the eye. So refractive error, that means whether you're long or short-sighted or 20/20, and how that can change things. And this echoes something that I said in a previous video where I talked about a couple of things I took. One was ibuprofen and the other was my ventolin inhaler, and they made me really quite long-sighted. And the really exciting thing is that there's been this study done which confirms my personal experience. So this is in the Investigated Ophthalmology and Visual Science webpage, and the study is called Association between Medication Taking and Refractive Error in a Large General Population based cohort. So this was, that means that it was done over quite a few people, you know, varying ages and so on. So they've got quite a lot of general information from it. And what they've come up with, so I shall actually read out some of it. So they looked at various medications. They looked at paracetamol, opiates, non-steroidal anti-inflammatory drugs. So that would, I think, include ibuprofen. Gabapentinoids. So those are anticonvulsants. Okay, all of those were associated with greater hyperopia. And it goes on, so between 0.68 and 1.15 diopters after taking these drugs. What it says is hypoglycemics, metformin glyburonide. I don't know what those are, but I assume it's something to do with blood sugar. They were affected with, they were connected with myopia, as was, no, this was, as was allopurinol. So purinol, that might be something for the joints, because purin is connected with gout. So so if anyone knows what these medications are, please put a comment, because I don't. But participants using bronchodilators, yeah, that is basically asthma inhalers. Okay, so that is the relief asthma inhaler, not the long-term medication that you're supposed to take. This is like your Ventolin, the thing that you take if you are wheezy, so you take it to help you stop being wheezy in that moment. So they were affected with greater hyperopia, and so ibuprofen and salbutomal, so that's in your Ventolin, basically. So that does tie in with my own personal experience. Now, I can't actually take ibuprofen because I have asthma. I took it the once and I just took one tablet, so not very much, and it did make me start to wheeze. So I took that as a sign, no, don't take that again. But it relaxed me so completely because I had some joint pain. And what I noticed was anything within 6 feet really was quite blurry, and anything up to my outstretched arm was blank blurry. So it wasn't even just a bit fuzzy, it was just like not there. And the same on one occasion when I took my ventolin, because I was kind of taking it less and less and less, because I've been getting better strategies so that I just don't use so much of it. Again, Ventolin has a tendency to make you shake, as any Ventolin takers will know. So again, it kind of relaxed everything, and I had exactly the same effect. And I've had this happen a couple of other times when I've just relaxed and everything has just gone, you know, within so much has just gone blank, blurry, and I've had to move back quite a bit to be able to see. That's even with glasses on a couple of occasions. And the interesting thing also is the gabapentinoids, the anticonvulsants that were mentioned. That actually strikes true with me, because I was about to be tested for epilepsy literally before I got glasses that actually helped me, because I was struggling with lights. I was getting very dizzy, and anything that had a strobe effect was really knocking me out. So they wanted to do a test, but I was fine once I got the glasses, so there's no problem there. But at the same time, I had a friend, he began to develop epilepsy, and he was also told he was mildly, only a tiny bit long-sighted, and that kind of made me wonder, I bet there's a connection between the two. And that study tells me straight off the bat that hyperopia and epilepsy are pretty close bedfellows. And there also have been earlier studies that show that very severe eye strain, which you get basically if you have uncorrected hyperopia and you keep trying to go without glasses, the symptoms, there is a crossover between that and epilepsy. So the next question is, are these drugs making people hyperopic? I can safely say no, that is not the case. What is happening is that they are bringing out a hyperopia that is already present. And that again ties in with my own personal experience. The hyperopia I experienced before I had glasses, it was transient, and as soon as it came back, so did all my other symptoms, because my eyes were strained. And once I relieved the eye strain, I was actually getting a lot less of these symptoms. I mean, my asthma did get a lot better. I needed my teeth fixed as well. There was a problem there, but certainly eyeglasses really helped reduce the sensitivity, and also the joint pains I was getting, I mean, that really cleared up basically. And also, like I said, I was about to go for an epilepsy test, and the fact that, you know, a pair of glasses fixed that showed that no, there was no epilepsy. It would have been an unnecessary test. So I'm really pleased that that study has been done. Now, what I really hope comes from it is that, you know, if people are taking these medications and their eyesight changes, you know, they don't get worried and think, oh, the medications made me more long-sighted. It just means that it's probably relaxing you a bit. And also everything around the eye muscles is relaxing, so you just cannot hold that amount of tension, which is keeping you a bit more emmetropic or myopic or whatever. So obviously then you would want to go and see an optician to get, you know, the correct glasses for hyperopia, because that will help you keep more relaxed generally, and will cut down on some of the symptoms that you're taking these drugs for. So, you know, so that should be better all round. But yeah, I am so pleased that a proper study has been done about this. So yeah, so please go and look at the web page. I'll put the link below in the video, and yep, please like and subscribe, and hope to see you in my next video.